So, I hate being first, but when your name starts with an A and the second letter is a C, don't have much choice. Okay. So my project was done in conjunction with Dr. Michael Stahl from Melfort. So I've got part of it, and Michael will have the other part. And it's on modernization of physician services using technology, basically in-office visits. And the SMA economics team actually designed the project. So the current issues is that in fee-for-service there are no billing codes that support non-face-to-face physician-patient encounters, and it's been a thorn in the side of physicians for about the last 15, 20 years. But lately it's become a thorn in the side of patients as well, so we have some traction here now. So the technology needs to be HIPAA compliant, trackable for billing purposes, obviously, and user-friendly at both ends, physicians and at patients as well. So we initially chose React software to trial this project. React was developed by the CMA arm Jewel by an intensivist in Quebec. So we thought this would work quite well, but Murphy's Law prevailed. So first of all, we ran into some funding issues for these visits because we're switching an office visit to a non-office visit, and there were some glitches in funding there. We also realized that this is more of a proof of concept as opposed to actual data collection, and it was a much bigger project than what we thought. So we had to scale it down, and so that was part of our issue. And also ran into problems with implementing React software on a large scale within the office. It did require some explanation. I worked well on iPhones, but couldn't get it to work on an Android. So there were some problems with that, and we can elaborate at the poster session on that one. So the key learning was I learned how much I did not know about a quality improvement process, and that was humbling. And the first meeting here last fall, I think I wanted to leave that meeting and say, no, I am not going to do this, because it just was an overwhelming amount of information. However, we persevered, and so about the CQIP experience, it was challenging, but it was worth the time and effort, although I have to say it did take a lot more time than I was expecting. So that was the big challenging part of it. And when you're trying to do your regular work and this on top of it, it was a bit daunting. But the workshops, they were the best part. And the best part about the whole thing was having a chance to interact with colleagues. And there were a couple people here that I stalked on a regular basis, trying to find out more about the work that they were doing. So that was really the best part of it. And the final work, teamwork is essential. You need your team around you. We had some really good coaches, and that was really great. And we did rely on the coaches as well. So the other part of this talk will come later. And I have to say, because this is a proof of concept versus data collection, Michael Stahl actually rescued the project because he did collect a lot of data. So that's how this project got rescued, and that's why we have the poster that we do. So that's my talk.